For decades, heart disease has been one of St. Lucia's deadliest threats, but May 16th and 17th marked a seismic shift. Tapio Hospital again successfully performed coronary angiography and, on this occasion, also made angioplasty available as a treatment option, ushering in a new era of cardiac care right here at home. Heart catheterization is a minimally invasive way to see and clear life-threatening blockages in the heart's arteries. It involves threading a thin catheter through the wrist or groin to the heart, where X-ray imaging guides the diagnosis and treatment of life-threatening coronary artery disease. The new cath lab is a product of years of persistence, clinical training, and strategic investment.
Heart disease in itself represents a significant proportion of the things that we see in hospital on a daily basis. It's almost like our daily bread. And depending on what the issue is, sometimes we face serious challenges because some things that we need to do for our patients are not available on island. At this time, I should say, were not available on island. And in the very early days, when I just came back, it was a very common thing, sending patients to Martinique to have coronary angiography in particular, the procedure to look to see where the blockages are, if there are blockages in the arteries feeding the heart muscle, and where those blockages are, and how serious they are, and whether they need treatment.
Previously, patients always had to leave the island often, urgently, to seek this care in Martinique, Miami, or Trinidad. Many couldn't afford the trip, and lives and heart muscle were lost in the process. While some emergency cases may still require transfer, now we have the option to run this high-stakes race against time on home soil.
There is a saying that minutes mean myocardium, meaning the longer you take to get to the hospital, the longer you take to pop in some aspirin, the longer you take to pop in another medication called Plavix or clopidogrel, the more damage ensues. You need to get in as soon as possible.
Cardiologists Dr. Daniel and Dr. Snack worked hand in hand with Dr. Julian Fab, an interventional cardiologist from Martinique, to build a program from the ground up.
Yes, because when you start this procedure of angioplasty, of our coronarography angiogram, it's important to have a help with a proctor, so a mentor, to help step by step when you do this procedure. Because even if all is okay, even if all is secure, it can be complications. So it's important to have a background to correct if you have a problem. That's why it's very important for this. And during my presence, I teach too to analyze the lesion, because sometimes when you see lesion in coronary vessel, it's important to know what's the best treatment after. If you need just medication, if you need more, if you need a bypass, for example, or if you need angioplasty. So it's important to have a second opinion, and I know more than them. That's why it's important to discuss together what's the best for the patient. And the second thing is to teach the technique, because it's important to know the treatment tips. Yes, treatment tips to reach to open the vessel, to get it, to do this exam.
Tapio invested heavily in training, staff readiness, and modern equipment. Fluoroscopy imaging, emergency kits, and ICU backup. The entire team, from nurses to radiologists, was prepared for excellence.
As a medical director, I'm very excited to be able to offer this service to the St. Lucian public. We are now able to do cardiac catheterization or further treatment for heart attacks.
The same technology may soon help diabetic patients avoid amputations by clearing blocked leg arteries. With just a few cath labs in the English-speaking Caribbean, Tapio's facility is poised to serve the wider region, from St. Kitts to Grenada, offering timely intervention at a fraction of the cost.
Nothing that we have achieved over the last 48 hours would have been possible without everybody. I'm talking about the executive branch of Tapion Hospital, the board of directors, all our nurses. It would be remiss of me if I didn't mention Dr. Julia Fab. he has been an excellent proctor. Excellent proctor. He's the one we normally refer our patients to also. But he has been truly an excellent proctor.
With every heartbeat saved, Tapia Hospital proves that the world-class care is possible right here in St. Lucia.